Who's the sickest patient used to go?
Patients piling up, frustration building. New Yorkers are posting on social media the dire situation on the front lines.
It literally is like a war zone, and everyone is in it, in the trenches together, and we have to rely on each other.
For Dr. Tanzib Hussain, the shock wasn't the initial wave of patients at his hospital in Brooklyn. It's what happened next.
All of the patients that initially came in, now 4 or 5 days in, they're all, to put it in the clearest way, they're dropping like flies.
He says almost all of the patients he's seen on ventilators have died. Final conversations are solitary affairs. Patients are kept alone. No visitors allowed.
So going to these patients and telling them that this might be the last time they're awake, that's very tough. And I think that's what impacts the physicians that are on the front line, the nurses in the front line, more than the numbers or the fact that we're overwhelmed.
Supplies are limited, so hospital staff are making do as the emotional toll adds up.
Each shift, every shift I've worked, I've cried after leaving from the shift. We are doing everything that we can to help everyone, to see everyone, to treat everyone, but we have limited resources.
We do have some progress.
The mayor says supplies are coming, and Dr. Hussain welcomes the temporary hospitals being built. But woven into their work, the fear that they'll fall sick next.
Because it just seems inevitable to us. But we're doing the job because this is what we signed up for.
And his warning for the rest of America, New York is a preview of what's to come.
People are not recovering at a rate that we would hope. We don't necessarily have adequate treatment yet, and the hope is that that's going to come. But until we have that, patients are getting sicker, they're staying sick, and it's serious.
At one overwhelmed hospital in Queens, a message of thanks as doctors across the city dig in, knowing the worst is yet to come. Stephen D'Souza, CBC News, Toronto.